Hello and welcome everyone to our latest podcast on effect of vitamin C, hydrocortisone and thiamine versus hydrocortisone alone on time alive and free of vasopressor support among patients with septic shock. The vitamins trial. This was published in JAMA in January 17th. So why did we need to do this trial? Merrick et al. In this retrospective study published in just 2017 showed significant mortality benefit by giving this protocol. Let's see how it is evaluated in this particular trial. So they hypothesized that treatment with combination therapy would increase the time alive and free of vasopressors compared with hydrocortisone given alone. Let's look at the methodology used in this particular trial. The study was conducted in 8 ICUs in Australia, 1 in New Zealand, and 1 in Brazil. It was an investigator initiated, multi centered, open label, parallel group, randomized controlled trial. The inclusion criteria was definition of sepsis according to the sepsis 3 criteria and septic shock based on the same criteria. Patients were allocated in a 1:1 basis. The patient in the intervention group received vitamin C 1.5 grams every 6 hourly, thiamine 200 milligrams BD, and hydrocortisone 56 hourly. So, as you can see, the patient in the intervention group received hydrocortisone, thiamine, and vitamin C. Control group received only hydrocortisone. So, the outcomes measured were time alive and free of vasopressor on day 7, that is 168 hours after randomization. This was defined as the time censored at 7 days that a patient was both alive and had not received vasopressor for at least 4 hours. The secondary outcomes were 28-day to 90-day mortality, 28-day usage of vasopressors, mechanical ventilation, and renal replacement therapy, change in SOFA score at day 3, and length of stay. The sample size calculation has been elaborately described in the paper. They have changed it multiple times based on their intermittent analysis. We're not going to the details of this because it doesn't affect the result much. So 786 patients were screened, 216 were randomized, and 211 were analyzed. So what did the results show? Coming to the primary outcome, it was the time alive and free of vasopressor described in median and IQR in hours. In intervention group, it was 122 hours, and in the control group, it was 124.6 hours. So you can see there was no significant difference in the primary outcome in this particular trial. So authors concluded that in patients with septic shock, treatment with intravenous vitamin C, hydrocortisone, and thiamine when compared with intravenous hydrocortisone alone did not significantly improve the duration of time alive and free of vasopressors over 7 days. The strength of this trial are the a priori publication of the protocol and plan, the reason for sample size being clearly explained, and a multicentric RCT involving 3 countries. This study has various limitations and some very fatal flaws. We'll try to analyze what these limitations are and how do they affect our interpretation. The study was open label and unblinded outcome assessment, thus creating a performance and assessment bias. The sample size calculation has too many assumptions, while the assessment was done based on parametric test. Ultimately, the analysis was done based on non-parametric test. The endpoint, which may seem clinically relevant, is not a validated measure. Now let's look at the 2 points which Professor Merrick raised about the trial. The time to initiation of therapy. The time to ICU admission and randomization was mean 12 hours. The time to randomization and first dose of vitamin C was mean 12 hours, which means that 50 patients received the first dose of vitamin C after nearly 24 hours, which is a really long time. If you look at the Merrick's trial, the retrospective study, it is clearly mentioned about early use of intravenous vitamin C. which they recommend during the first dose of antibiotic. No hemodynamic data is available, no data on fluids, no data on target map, no data on vasopressor usage, which is surprising for a study on septic shock. A little bit about the study endpoints. The study endpoints, like the primary outcome of time to alive and free of vasopressor on day 7, or the various 28-day secondary outcomes. These are classical for a study designed to fail, just as Professor Merrick told in his rebuttal for this trial. Let's see the fallacy of using these outcome measures. If we see the primary outcome, the mean time free of vasopressor was roughly 120 hours. This comes to nearly 5 days. So 50% of the patients were off vasopressor by 48 hours. So the clinically relevant outcome for us is the time on vasopressor rather than off vasopressor. So by measuring the extra time of 120 hours, we are just diluting the finding rather than finding anything significant. Similarly, the 28 days of these free outcomes of intervention, the average length of stay in ICU is 7 to 8 days. The time of intervention are even lesser. So when we calculate these free days at day 28, we just dilute the data and make the chance of finding a clinically relevant outcome even lesser. So what is the take home for us? We currently use hydrocortisone, ascorbate, and thiamine in septic shock in our practice. This particular study doesn't change our practice because it doesn't show any serious side effects, and there is a significant improvement in the SOFA score at day 3. And we look forward to see this protocol being evaluated in better clinical trials with better secondary and primary outcomes. Thank you for your patience and check our website for further information. Thank you.